welcome to our special show. I'm Gargi Rawat. Epilepsy is a common neurological disorder whose consequences are influenced socially and culturally, especially in India. The effects of epilepsy on education, employment, marriage and other essential social activities are well known. It is indeed unfortunate that a common disease such as epilepsy has such a strong social stigma attached to it. The social attitudes, stigmas and discrimination against epileptics are often more devastating and damaging than the disease itself. This suggests a critical need for education and awareness about epilepsy in society. And today we have with us from Hyderabad, Dr. Zafar Shah Nawaz, well-known consultant in seizure disorders, or in other words, an epileptologist. I say well-known because he has patients from Kenya, Somalia, Yemen, Iraq, Iran, Dubai, Saudi and Nepal, apart from every corner of India. He specialized in epilepsy from King's College, UK, where he received the Bateman Award in epilepsy for his work on evolution of pediatric epilepsy syndromes. He went on to UCLA, US as a research scholar, where he worked with well-known epileptologist Jerome Angel. Coming back to India, he was a consultant at the global hospitals and now has established his own Hyderabad Epilepsy Center. He sees around 400 patients per month of only epilepsy alone. He will provide us with all the information we need about epilepsy today. In the Winning Over Epilepsy program, Dr. Zafar will also help us debunk some myths about epilepsy. Let's put epilepsy awareness back in the spotlight on National Epilepsy Day. Let's begin our questions about epilepsy and just what is it, and is it just one type of epilepsy or are there many different types?
Epilepsy is a disorder of the neurons of the brain in which there is sudden and abnormal electrical activity in the neurons, which leads to change in the sensorium of the individual. He will fall unconscious if all the brain neurons are taking part in that, or he will have loss of awareness if part of the brain is involved. Epilepsy cannot be labeled as epilepsy if you have just a single fit. Two or more seizures which are unprovoked are absolutely a must to label it as epilepsy. Epilepsy is not just one type. There are four major types as per the new classification. One is generalized epilepsy, the other is partial or focal epilepsy, the third is a combination of generalized and partial epilepsy, and the fourth is unknown, or rather none of these two.
All right, so it's very important to understand that there are so many types of epilepsy, and also if you could tell us what are the common causes of epilepsy?
The common causes of epilepsy are, most common is genetic type, the second is brain malformations, the third is birth asphyxia, the fourth is infection in the brain, that is meningitis or encephalitis, the fifth we can say is trauma to the brain, head injury, and the sixth one probably mostly in elderly people, that is CVA, cerebrovascular accident leading to hemorrhage or embolism in the brain, and space-occupying lesions which are tumors in the brain or cysts. The last but not the least would be metabolic epilepsy, which is very, very rare.
And how is epilepsy diagnosed? Some people are diagnosed as children, some later on. So can you explain regarding its treatment and affordability as well?
Epilepsy, by a version I witnessed, is saying that some patient fell down and had rhythmic contractions of the body. He was frothing and he had a tongue bite. Is enough to understand that he had a fit. But the scientific basis of diagnosing epilepsy is by EEG. The face of the epilepsy appears on the EEG, provided the person who is analyzing the epilepsy is well versed in analyzing it. Otherwise, it is usually reported as normal. EEG has to be done on a very standard machine with standard filters and the standard conditions. The treatment of epilepsy from times immemorial has been drugs. Apart from drugs, we have alternative forms of therapies like surgery for partial lobe epilepsy, temporal lobe epilepsy, mesial temporal sclerosis, and the removal of epileptogenic focus by mapping it on by video EEG. We have another form of treatment. We call it as vagal nerve stimulation. This is they place a device in the neck parallel to the vagus nerve and then connect to it. But from the Indian point of view, it is very expensive, and what it does is just reduce the seizures by 40%. Doesn't completely stop the seizures. We have a latest form which is very promising, that is implantation of a electronic microchip between the skull and the focus, which is giving rise to the seizures. The electronic chip recognizes the impending seizure impulses and aborts it even before the seizure has taken place. Coming to the affordability, the older medications are cheaper, carbamazepine, phenobarbital, and phenytoin. But oxycarbamazine, topomac, and lamotrigine are slightly expensive. The latest medicines like levetiracetam, zonisamide, and rufinamide are quite expensive. But it depends on the doctor who is writing the prescription. If he is sure of the type of epilepsy he's got, then he would definitely write a single medicine. And if he's not sure of the type of epilepsy, he would write 5 or 6 medicines, 2, 3 for the generalized epilepsy, 2 or 3 for the partial epilepsy, which would dent the patient's pocket. VNS and surgical, option is very expensive.
We talk about drugs, and that seems to be the most common way to treat epilepsy, at least that's available in India. What about the side effects of drugs, if you could tell us a bit about that, and especially when it comes to children and in the course of pregnancy?
Sure. Like any other drugs, epilepsy drugs also have side effects, but they are generally very safe. Allergic reaction is quite rare. They usually give rise to some weight gain. There could be nausea, there could be sleepiness in daytime, there could be tremors in the hands, and very rarely there could be loss of hair in women. That is also very rare. In a normal individual with normal functioning kidney and normal functioning liver, these drugs do not damage the kidney or liver. Hyposexuality or infertility due to PCOD are genetic inherent of certain types of epilepsies. Medicine is not to be blamed as it is. Please get that very straight. There is a FDA protocol available for writing medicine in pediatric patients as well as pregnant patients. If you follow that strictly, then I don't think there should be any problem in side effects.
All right, that's good to know now. And when we introduced the show, we talked about epilepsy, and we did say it's one of those diseases which have a lot of social stigma attached to it. So if you could tell us a bit about these myths and superstitions as well as misconceptions around epilepsy.
Yeah, I'd love to do that. These patients who they are thought to be possessed by spirits or demons, they are taken to some place and beaten or thrashed, thinking that they can set the spirits or the demon free. That is not the way. It's a misconception. I have seen patients being asked to sleep in the graveyard, drink blood, and eat pork or defecated matter. Children are cauterized on the forehead, thinking that the epilepsy could stop. There are people who rush to the fitting a patient, bringing close to his nose onions and chappas, thinking they're going to abort a seizure, which is again wrong. Eating plantains or sweets or on Amavas night, full moon night, they could have more seizures is also a wrong conception.
So some people think that there's especially a need to create awareness in rural India as well, while some of the misconceptions are there in the city. But in rural areas especially, could you tell us what are the kind of social problems faced by epileptic patients and some of the issues that they have shared with you?
Yeah, actually the social stigma with epilepsy is too high. In fact, these people are looked down upon. They are not at all treated on par with other people. They develop severe inferiority complex and they shun to go to gatherings, functions, and they in fact are made to feel like aliens. A single fit will deprive them of education or job. They're thrown out. Even if they come across, they somehow go ahead with this, the demon of marriage is on their way. Marriages are very difficult because somebody has seen them fitting, would not come with proposals to them. And if they reveal that they have epilepsy, they run away. If they conceal it, they say, you have cheated on us. I know of certain couples who, as a result of consanguineous marriage, have had abnormal children, children with learning disabilities, with sparsity, unable to talk or walk. They tell me that they don't even wear new clothes. They don't celebrate festivals. They don't even sleep together for fear that they might have an abnormal child again. So these are the social problems of patients with epilepsy. Front of these forms on women, they are thought to be, to get married to a woman with epilepsy is a bad woman. Some of the epilepsies have infertility genetically, and they have to first see that the seizures and epilepsy is under control and tell the treating doctor they are going to plan a pregnancy. So the doctor gets a chance to change medicines if he wants to. And during pregnancy, they should not have a single fit that will otherwise cause abortions and accident hemorrhage and cause very big fatal problems. If you are liaising with the treating doctor and the obstetrician, things should go smooth during pregnancy as well.
Right, doctor. Now, we also spoke about epilepsy and how it's diagnosed, and when it's diagnosed, what are the consequences of ignored or untreated epilepsy? Do we have many examples of that in our country?
Yeah, we do have a lot of examples. The people don't want to accept that they are epileptic. They reject it. And once it becomes very chronic, you start losing the cognitive faculties one by one. The attention span, the concentration, and you are not sharp as before. They go into psychiatric problems like depression, homicidal, suicidal tendencies. Apart from this, people who have no control over their epilepsy, if they drive on the road, they can meet with fatal accidents. They can drown. Ladies working in the kitchen can fall onto the studio and get themselves burnt. People can fall, the technicians like plumbers, electricians can fall during a fit and succumb to their injuries. Apart from that also, people on the having a fit on the steps or in the toilet can have blood injuries, head injury, and fractures of the body. There is a type of epilepsy called the Jan's epilepsy in which there is recurrent dislocation of the shoulder joint. The direct medical complications are status epilepticus, which is an emergency. They keep on having seizure one after another without regaining consciousness in between. That's fatal if not treated in time. And there's another one we call it as SUDEP, sudden unexpected death in epilepsy. This is because of the seizure traveling to the cardiac respiratory center in the brain and suppressing it very severely, leading to instant death.
Well, Dr. Zafar, thank you so much. You've told us so much about epilepsy and the challenges that people face in the country and how there's this need to create more awareness. We'll slip into a short break and come back with more. Stay with us. Welcome back to our special show, Winning Over Epilepsy. We're joined by Dr. Zafar, who's answering all our questions about epilepsy, the kind of social stigma around it, as well as the various treatments. Dr. Zafar, should the anti-epileptic drug be discontinued during any other intercurrent illness? What is the effect of seizures on memory?
Yeah, like I said, it affects the cognitive faculties. One of the cognitive faculties is memory. They lose memory very fast. And then, of course, another thing which I told you is that in certain other medical problems, illnesses, you have to be cautious when you're using the anti-epileptic drugs, like in renal failure, that's kidney failure, or when you're using certain antibiotics like cephalosporins and all, you need to be a little careful. You have to adjust the dose as well as, if necessary, ask the doctor, prescribing doctor, to change the antibiotic, or in liver failure and, like I said, renal failure, you have to probably sometimes change the drugs and give them another drug. Memory, yes, sure. It's one of the worst, this thing, what you call the probably consequences of having a chronic epilepsy. You lose memory very fast. I have a patient who doesn't remember what she has eaten in the morning and what she has eaten in the afternoon. She has been having fits, epilepsy, for about 15 to 20 years. So that is one of the sequel of epilepsy, chronic epilepsy.
All right, it's a challenging way to deal with, and on this day we would like your message. So many different groups have been affected, children, adults, teenagers.
I would tell them epilepsy is not end of the world. It's better than many untreatable disease. Epilepsy is treatable. You have to take it in your stride, accept the diagnosis, then take a pill in the morning, a pill in the evening is neither bitter nor expensive. Go through the treatment, see that the epilepsy is under control, get back to your institute where you are studying and get back a job or get self-employed and married. Life will smile at you, and at one day you can also forget that you ever had epilepsy. For the mothers who have their epileptic children, I would say those who are unfortunate, they are having mental disabilities like cerebral palsy, spasticity, vegetative life, unable to talk, unable to walk. For them, you need to take the help of the special schools or the special school teachers. But for those whose IQ is normal and they have passing epilepsies of the childhood, you have to send them to the school. Please do not keep them at home. And do not pamper your children. Don't allow the grandparents to pamper the children. Let them go out, let them talk to children, let them play, let them do everything, of course, in the framework of safety. If you pamper a lot, they are going to become introverts, unsocial, timid, and tomorrow they are going to develop personality disorder. And for those children who are very hyperactive or very aggressive, do not lock them in a room. Do not chain them. We can treat them with drugs.
Thank you so much, Dr. Zafar, for speaking to us and educating us about epilepsy. It's important for society at large to be aware and know and have none of those sort of misconceptions that used to exist decades ago and still exist even today. Hopefully, this would have helped our viewers educate themselves. Thank you so much for joining us, and thanks to all watching at home.
Thanks for allowing me to talk.